Welcome to the State of Mind virtual speaker series. This series has been developed to provide education and support to youth, caregivers, and educators during this challenging time. This series is a collaboration between two local nonprofits, One in Five and MindPeace, and various community mental health partners. We're glad you're here to educate yourself and to learn how to keep your brain in a healthy state of mind.
Hi, this is Mike Mercer, and I'm with Screen Education. We're based in Cincinnati, and I would like to thank One in Five and MindPeace for inviting us to participate in the State of Mind speaker series that they're putting on. I will be discussing the research that I've done on social media and its impact on mental health, the mental health of kids, and in discussing the research, where appropriate, I'll discuss COVID and how it might have compounded the impact of social media on kids' mental health. And then at the end, I'll get into what we can do to mitigate the problem. A little bit about my research. I've been doing research for 4 to 5 years on issues that are at the intersection of information technology and human wellness. And I've done about 20 research studies in the last 4 to 5 years. And the primary focus, the big issue that I focus on is tech addiction, screen addiction, digital addiction, smartphone addiction. And because social media is one of the three major addictive platforms, I've necessarily had to do research on social media. So that's where I'm coming from with this. It's looking at social media initially from an addictive standpoint, and then looking at what that addiction, what effect it has on young people. I'd like to start off just by talking about how much time kids are spending on social media. So if you look at, say, start off looking at research on how much time overall kids are spending on screens, Common Sense Media did a study, I think it was about 2 years ago, and found that kids were spending 7 hours and about 20 minutes every day using screens for purposes that had nothing to do with school. So that was 7 hours and 20 minutes a day for using screens for social, entertainment, recreational purposes. And of that 7 hours, if you look at the research on how much time they're spending on social media, the social media is taking up a lot of that time. So the research that I've looked at various studies, and the numbers you'll see for, say, teens are anywhere from 2.5 to 4 hours. There's a range. And that actually echoes the research that I've done qualitatively with kids. So when I've done a focus group with kids, I'll ask them to pull their phones out and look at their screen time measures. And I'll usually hear they're spending anywhere from 2.5 to 4 hours. It's usually not below 2 to 2.5 hours. But the upper end seems to be about 4 hours. You'll get some outliers about 4 hours, but that's what we're talking about here. We're talking about 7 hours a day on screens, and 2.5 to 4 of those hours are on social media. We know during COVID that the amount of time people of all ages are spending on social media has increased. So I did see a recent survey that found that it was a survey of people of all ages, including kids, and 73% said that they've increased the amount of time they spend on social media during the COVID pandemic. So suffice it to say, the general point here is that they're spending hours every day using social media, which begs the question, what's the environment, right? So what environment are they immersed in for the 2.5 to 4 hours each day? And there's one word that comes to mind, and that is it's a toxic environment. So I want to acknowledge, obviously, there are benefits to social media, right? There are very positive dimensions to social media, but there's also a very toxic component to the experience. And that's something that we've actually done some research on. And I'd like to just share with you a couple of statistics from our research to give you a sense for how toxic the daily experience might be for kids. So, for example, this is a national survey we did of over 1,000 teens nationwide in partnership with EMI Research Solutions and Stark Statistical Consulting. So we found in this particular survey, 38% of teens say that they witness gossip every single day on social media. 45% say that they witness drama every single day on social media. And when it comes to bullying, they witness it less frequently. So 36% they say they witness someone being bullied every week. But significantly, 31% have said that they've seen online bullying ultimately result in physical violence. So that'll give you a sense. I don't want to bore you with too many numbers, but we've also asked, basically, do you find, when you witness these things, do you find them upsetting? And we're finding that people do. At least half say it's upsetting to witness this. The people who get upset by witnessing bullying is something like 89%. So they're immersed in a toxic environment, and it's a burden to them. It's an emotional burden that's upsetting to them, causes anxiety and upset. We asked in that survey a question that was, the goal was to sort of provide sort of a summary sense for just how toxic that environment is. And we asked the kids, do you feel that social media contributes to conditions that result in school shootings? So is it a factor, right? Is it so bad that it's a factor that pushes school shooters to commit such a horrific act? 73% said yes, it's a factor in school shootings. Another way that we've examined this issue is through research we've done with kids who attend overnight summer camps. And these are camps that don't allow phones. So we actually partnered with the Jewish Community Center Association of North America and Stark Statistical Consulting to do this national survey of 1,100 kids who attended Jewish camps that summer it was an average of 4 weeks. So these are kids who are at camp for 4 weeks with no access to technology. And we asked them, how it felt to get away from social media for 4 weeks. And 93% said they were relieved to get a break from social media while they were at camp. So they weren't jonesing for social media. They felt a sense of relief. And then a related number, 80% said that they were less anxious and stressed at camp for the 4 weeks because they didn't have to keep up with social media. So those measures reflect what a burden this experience can be for kids. And then we had other questions. Basically, we found, roughly speaking, about half of these kids said they found that there was, overall, they experienced less drama, gossip, and bullying at camp because they didn't spend any time on social media. So we've also done research to try to understand what it is that allows people to create this toxic environment. And to say that another way, what is it about social media that makes it so easy for not just kids, but also adults cross a line and treat each other poorly? And I want to be clear, I'm not pointing fingers. This I feel is a general problem. I've crossed the line, and most of my friends have crossed the line. And we've seen a lot of very powerful adults in our society who cross the line every day on social media. So this isn't just a kid problem. So we wanted to analyze and understand what is it that allows people to cross this line. And we found two factors in the research, two general areas. One is there are aspects of communicating in an online environment that make it easy to treat each other poorly. So, for example, we found that people, for example, have a feeling that the online and the face-to-face worlds are just two separate worlds that don't connect in any way, right? So that gives you this false feeling that if you behave poorly online, it's not going to affect your real life. We also learned that people feel like it's easy to objectify other people because this is psychological distance. You're not face to face. You're communicating often through text. You're not speaking. You don't hear someone's voice, and they often have a static photo that you're communicating with. So they're not fully human to you, and that makes it easy to objectify them, and as a result, treat them poorly, to lack empathy for them. People also told us that this issue of there being sort of an ambiguity in emotional tone. So when you're typing, you can't necessarily convey emotional tone effectively, and this can create problems. It can lead to confusion. So, for example, someone might tease you in a joking manner, and you don't sense this. You think that it's a serious criticism. You get offended. And then another aspect of being online that makes it easy to cross the line and treat people poorly is being anonymous. And that could be simply, having a dummy account and not presenting yourself as being who you really are. Or it could be simply the fact that in online environments, you're connected to so many people, right? That in a way you're anonymous. There's this mass audience and you feel anonymous. So those are some factors, related to being in an online environment that make it easy to cross a line and treat people poorly. We also learned that there are social or cultural factors that make it easy to do this. For example, people told us that conflict online has been normalized. It's just accepted that if you get online, you're going to argue and be nasty to people. So it's become a normalized way to be online. Kids have also told us that it's a real easy channel for their natural teen rebelliousness, right? So it's just very easy to rebel in that way and to channel that energy. And then they've also mentioned poor behavior modeling by adults. And they gave us examples, not just of celebrities and athletes and performers and actors treating other people poorly, but also adults in their lives, like the parents of friends treating people poorly online. So I just want to summarize that point. There are dimensions to the online social media experience that make it easy to cross a line and treat other people poorly. I don't feel that it's just about us. I think this is a new environment. It's a new experience for us. And I think we have to take into consideration that these are things that maybe have to be counteracted, put it that way, to bring us more in line with how we behave, to make our behavior in person and online more consistent. We'll put it that way. We've also done some research on face-to-face versus virtual socializing. And here's the point here. What we've basically looked at is, are people starved? Is socializing with other people through social media crowding out time to socialize face-to-face? And if so, is that frustrating? Do people feel starved, right, for more face-to-face socializing? And here are a couple of questions we've asked on one of the national surveys with teens. We found that 33%, so a third of teens, said that they spend more time socializing, and this is specifically with close friends. So they spend more time socializing with close friends online than they do socializing in person. And we also asked them, do you wish you could spend more time socializing with your best friends in person and less time socializing online? And 2/3 said yes. I'd like to spend more time socializing with my friends face-to-face. Another way we sort of got a sense that socializing online is sort of crowding out time socializing in person is from a question we asked in that survey. How often do you end up not doing something that you would like to do because you couldn't put your phone down? And a third of teens said every single day there's something I would like to do, I'd enjoy doing, that I don't do because I can't put my phone down. And we asked them for examples, and it was all really things that would involve socializing. It was going to movies with friends, going to the park with friends, going out to eat with friends, or doing those things with your parents, playing sports. Friends were going to play basketball, and I didn't go, that sort of thing. So again, the summary point there is that our research has found that, face-to-face socializing and communication can nourish the spirit, and social media is crowding out a lot of the time that people used to spend interacting face-to-face. And this is leaving kids feeling kind of lonely and hungry for more face-to-face interaction with their friends. I also want to point out that you can look at the research we've done with kids at summer camps without access to tech. It's basically, we're studying the benefits of a digital detox. That's really what it is. And we've done about 7 research studies with kids at camp, or we've done 2 with college students on doing rustic camping where they don't have access to tech. They can't get a cell signal, and there's no Wi-Fi. And this is really, in terms of mental health, it's transformational for the kids. What it does is it awakens them to the problems that social media is causing them. So they basically migrate from a tech-saturated state of mind to a tech-free state of mind. And it takes about 5 days to fully make that migration. And once they get to this new tech-free state of mind, they look back and they contrast it, they compare and contrast it with the tech-saturated state of mind. And it's through that process of comparing and contrasting the 2 states of mind, they start to awaken to the problems that tech addiction and social media are causing them. And one of the studies we did with college students, we had 2 of them tell us that they dropped their social media accounts after having gone through an experience of being in the woods for 7 days without tech access. So it can be really beneficial for kids to go through these digital detoxes. And it's so beneficial and I also want to say I've gone through them too. I go camping and I've experienced a number of these things, and they've been transformational for me. I got rid of my smartphone 6 years ago after camping for a week. And then 3 years later, I got off of Facebook. So it can be transformational. And I almost feel like it should be sort of institutionalized as a rite of passage, for young people. So that's an overview of, the issues we've looked at with social media and how it affects kids negatively. And I'd like to just talk through some solutions that I've devised. And I look at this more long-term. So these are more long-term solutions if we want to address the problem over the long term. So first of all, I feel that a critical component in addressing the mental health effects of social media use on kids is to make them sort of conscious of or aware of these dynamics. And I'm specifically referring to the factors I mentioned that make it easy to cross the line and treat each other poorly. I think if young people can be made conscious of those factors, it really could help serve as a check and balance on their behavior. So if they can be aware, for example, oh yeah, it's really not realistic. It's in the back of my mind, I do feel like the online world and the real world are separate, and that if I hurt someone online, it's not going to affect them in their personal life. That's not realistic. It does hurt them. Let me try to keep this in check. So making them aware of those dynamics that we identified in our research, I think could really be helpful. Number 2, reducing the time they spend on phones and reducing the time they spend on social media. Now, for me personally, I do feel that this is something that is so serious it needs to be addressed at a national level. I feel like that we should have legislation, and I do feel that if these tech companies cared about kids, they would set hard daily limits on kids time limits in terms of how much time they can use the apps every day. Um, and I do feel that schools can play a huge role in this too, and obviously along with parents. But I feel that there are several institutions in our society that can come up with ways to reduce the amount of time that kids spend on their phones and on social media. And I don't think it should be considered to be a big violation of a human right if we say, nah, we don't want you spending 4 hours in this toxic environment every day. You know. So any way we can come up with to set limits on our kids personally, or if we run a school, or if we're a teacher, I think would be extremely beneficial. I also feel that if we could, given that we know that kids are not doing foregoing social activities and organized activities, I think if we can somehow get kids more involved in organized extracurricular face-to-face activities, that would help to reduce the amount of time they're spending on tech and on social media. They're spending far less time than they used to doing extracurriculars, and I feel the pendulum needs to swing back in the other direction. And if we have to get tough, I think we should get tough. That might mean schools require them to do, I don't know, 2 activities a year, or parents require it, but I think we really need to start pushing our kids to get involved in extracurricular activities. And then the last thing I want to mention is the digital detox. I just want to reinforce that putting kids through a digital detox can be extremely beneficial in addressing these problems and helping kids become aware of how tech is hurting them and how social media is hurting them, and can be really motivating to get them to start to cut down on their time. Now, these detoxes, it could be going camping, it could be going to summer camp, or it could be that schools somehow begin to try to facilitate digital detoxes. So I want anyone, if you have any comments, suggestions, reactions to what I've said, you can feel free to email me. It's michael.mercier, MERCIER, @screeneducation.org. Thank you very much.
A special thank you to our State of Mind speakers and to you for joining us. More videos and educational resources can be found at 1 in 5's website. If you feel like you or your child is in need of professional support, therapists are available. Please refer to MindPeace's school-based or community resource page. For a mental health crisis or emergencies, patients and families are encouraged to contact their current mental health provider first. This allows the mental health provider who knows your child best to provide support and direction. If your child does not have a mental health provider and they are experiencing a non-life-threatening mental health crisis, you are encouraged to contact the Psychiatric Intake Response Center at Cincinnati Children's Hospital Medical Center. 513-636-4124. Call 911 or go to the emergency department if you are experiencing a medical emergency, a life-threatening mental health crisis, or are directed to go there by a medical provider. This will help limit the spread of COVID-19 in our community and allow our emergency departments to care for patients with the most critical needs first.